Since the start of the COVID-19 pandemic here in Wales, many hospital appointments were cancelled as the NHS prioritised services for those with the virus. But for those needing cancer treatment, a landmark agreement was made between Cardiff and Vale Health Board and a private healthcare provider, and over 1,000 patients have now been treated. Ellie Pitt has this special report, the first in a series leading up to the NHS's 72nd birthday this weekend.
In this private hospital, patients have been put above profits. At the start of the pandemic, the Cardiff and Vale Health Board and independent Spire Hospital joined forces. Private procedures were cancelled to make room for those having NHS treatment. Patients like 75-year-old Gloria, who has had breast cancer surgery here during lockdown.
I don't think the Queen could have had better treatment. They were so kind.
Gloria is a Roman Catholic and has lit a candle for the Spire staff.
The candle in St Patrick's altar for a week will be for everybody who've been involved in my life. What they've done for me, I can't thank them enough, because I'm here.
Spire's original contract has been extended for a further 2 months as the Health Board grapples with a backlog of patients and ever-growing waiting lists.
We are struggling and we're working hard to understand how we are going to provide services in the longer term within that environment where coronavirus exists.
It's been a busy period for one area of the hospital in particular. This is theatre, and it's where much of the NHS contract work is being carried out. They're performing urgent and cancer-related surgeries. And it's really where the two worlds, the private and the public healthcare sector, have come together. In here, NHS consultants and anaesthetists are now working alongside their new Spire colleagues.
We meet weekly to discuss capacity levels and if you can staff up appropriately, if we've got the right mix of specialities going through. Yeah, so I think it'd be sustainable, yeah.
As pressure builds on the NHS to deal with the aftermath of the pandemic, those in charge at Spire believe they will support the local health board more. Is this privatisation of NHS services by the back door? Or, since Spire is carrying out treatment at cost and not making any profit at the moment, has this been the nationalisation of a private hospital? It seems power sits with the health board at the moment.
So the way the contract works is the independent sector can't give notice. So if the health boards decide that they want to use our capacity, it's a rolling contract. But I think what I would say is, because we have got such a good relationship with Cardiff and Vale, they do understand we're a business and they do understand we will need to restart our private activity for the more routine elective procedures, and they want to work with us to enable us to be able to do that, but also for us to be able to support them with the backlog that there quite clearly is.
Until there's a vaccine, Cardiff and Vale Health Board needs these doctors, nurses and hospital beds to help the NHS's own recovery from coronavirus. Ellie Pitt, ITV News, Cardiff.